parasite that many Americans today think only affects animals and people in developing countries actually infected millions of people across the American South in the early 1900s. This is the story of one of the earliest public health campaigns in U.S. history. Hookworm spread through contaminated soil, entered the body through bare feet. Once inside, the parasite fed on blood, causing chronic blood loss, iron deficiency, anemia, fatigue, and even pica. Before doctors could understand what was happening, many people suffering from hookworm were simply labeled lazy. The illness became associated with poor rural whites that earned the name poor cracker disease. Then a parasitologist, Dr. Charles Stiles, identified hookworm as the true cause of the illness. His investigations focused primarily on white communities. Are you surprised? I know you're not. Though physicians knew Black communities were also infected, many believed Black Americans were naturally less susceptible because of presumed ancestral exposure to the parasite. Now, where the hell would they get that idea? Whole time their diseases are wiping out Native Americans. These racist assumptions meant Black communities were often excluded from early research and received less attention during eradication efforts. At the same time, some white officials blamed Black Americans for the presence of hookworm itself. In 1928, the Chicago Defender criticized Navy Rear Admiral E.R. Stitt. That's a hell of a name. Navy Rear Admiral E.R. Stitt criticized him. The Chicago Defender criticized him. The Chicago Defender. Okay. As long as we're clear. Okay. After he claimed there was no doubt Africans introduced hookworm into the United States. These contradictory beliefs weren't based on good science. They reflected the racial biases embedded in early medicine and public health, many of which continue to influence health disparities experienced by Black Americans today. Still. In 1909, with support from philanthropist John D. Rockefeller, the Rockefeller Sanitary Commission launched one of the nation's first large-scale public health campaigns against hookworm. The strategy was simple. Treat infected people, build sanitary privies to keep human waste out of the soil, and encourage people to wear shoes. Now, this did dramatically reduce one of the South's most devastating diseases and helped lay the foundation for modern public health in the United States. But it also reminds us that scientific breakthroughs don't automatically lead to public health equity. Public health has always been shaped by the society around it, science, its politics, its prejudices. And sometimes the most powerful public health intervention isn't a new medicine. Sometimes it's simply wearing a pair of fucking shoes and pooping away from the soil that you walk on. Right? Having a place to poop.